Hello everyone, my name is Gnana Raju. I'm a nutritionist, fitness consultant, and wellness coach working for last 22 years. With my experience of 22 years, I would like to present you one of the wonderful videos on role of nutrition, obesity, and lifestyle in gallstone prevention. So this is a good topic for you. Many people are asking me to make this video on this. So how to prevent these gallstone problems and also how to overcome to lifestyle and obesity. Let me make the thing straight. So, but before talking about this, let me introduce about myself. I was a former district registrar, group one officer, worked under government of Andhra Pradesh for 10 years. Then I quit my job. I did my MSc in zoology. Then also did a lot of certifications, including advanced diploma in nutrition fitness, certified in advanced clinical nutrition, certified nutrition fitness consultant, certified sports nutrition consultant in exercise science and calisthenics, and I'm a runner and marathon runner, and so many things are there. So now to make things simpler, basically the gallbladder stone are nothing but they're solidified stones. They're like a solidified, basically they're like fat stones. Okay, unlike stones in the kidneys, they are oxalate stones or calcium stones. But these stones are not like calcium or oxalate stones. These are like a solidified fat stones. Fat, like cholesterol, is a liquid that will eventually convert into solid. Okay, they're a very small level like 5 mm, 6 mm, maximum will be 10, 15. So it shouldn't cross more than 10. So otherwise it will be demanding operation. So usually many people have this, but they are not noticeable. But eventually over a period of time, these solidified stones, gallstones, may eventually become troublesome. So let me introduce what are the signs and symptoms and how to, causes and all. So usually whenever you find pain in the abdominal area, usually go to doctor for understanding. Then doctor advises for an ultrasound or endoscopic ultrasound or different kind of test by which will diagnose that you have a gallbladder stone. So where is this gallbladder? Gallbladder is nothing but a sac, a small sac, a pouch in which the hepatic juice, that is liver juice, will be stored. Okay, so now why these stones will come over a period of time? Before knowing this, let me introduce about two kinds of stones. The stones need not be only cholesterol gallstones. It also could be because of brown pigment gallstones. What are brown pigment? Like bilirubin, biliverdin, they are pigments that will give color to the urine, color to the number two, like stool. So those pigments also sometimes they solidify. Okay, also could be cholesterol also. Cholesterol like a liquid form of fat. So they also can form like a solidifying, converted to little solid kind of substances like particles. So by which you will get severe abdominal crampy waves kind of pain or sometimes periodical pain. And when you eat fatty food also it increases. Sometimes also end up in nausea and vomiting. Sometimes it also adds fever, chills and increased heart rate, sunken eyes and dark colored urine. Usually these are the five F's to remember. These are the risk factors for gallbladder stones. Number one, fat. Okay, if you are overweight or obese, above BMI is above 30, generally there is a risk for developing these gallbladder stones. Number two, female. So usually the risk is more for the female. Okay, so if their risk is there for female and comparing with the men. So the fertile means females age 20 to 40. So usually that time the risk of chances of gallbladder stones also will increase. So usually for women between 20 to 40 years because of the estrogen levels. Okay, not because of the age, but because of increased estrogen levels. So that could be um, because of increased estrogen level, gallbladder stones can increase. Number four is age. This is age factor. Above 40 years, generally men and women, some they can get this kind of gallbladder stones. This is an increased risk for the age. Number five is fair skin. The risk will be more predominant for Europeans, white fair skinned people than brown skinned people or black colored skin people. So alongside not only obesity, age and gender, there are also genetical factors and also estrogen, I said, high estrogen levels and some also could be because of sugar, diabetic levels increasing and cardiovascular diseases increases. Then also there will be increased risk for gallbladder stones. So microbiome, if the stomach is coming out and you have a bad microbiome inside the stomach, so then also there will be risk factor. So always a good idea to have good good gut good gut inside. So sorry, not gut but good gut inside. So it having with filled with good bacteria rather than bad bacteria. So now there are four stages in terms of gallbladder disease stages. The first two stages are not, danger. They are simple. They are not. They don't have any much symptoms. The first one is lithogenic, means they just form, and you can definitely prevent through exercise and diet. And you cannot able to trace them also. You don't require treatment also in the lithogenic, very small level, minute level. But in the next stage is asymptomatic. They are slowly increasing, but you don't have pain. But you have to keep on monitoring and prevention still through exercise and diet. But last two stages are symptomatic and complicated cholelithiasis. So for them, usually pains end up in pains and you require compulsory urgent treatment. You have to ask doctor for help. Doctors usually refer, surgical removal. So last two stages important. So that does not mean you should neglect at the first two stages. First two stages, if you are careful, you don't reach into last two stages. So let me explain about these are the five myths associated with gallbladder stones. Myth is something people believe but which is not true. So first false belief myth is gallstones are caused solely by high fat diets, which is not true. Even if you don't eat, yes, by eating high fat diets there is a risk, but it only not just only by eating high fat diets, like sometimes you eat lot of sugars also, high carbohydrate diet like idli, dosa, roti, chapati, then also there is a risk. So number two, only obese people get gallstone. This is also myth. Yes, obesity increases the chances of gallbladder stone, but does not mean lean people also will not get gallbladder stone. Lean people also, if they have excess fat, they eat excess sugars, they don't eat good fiber, then also there is a risk. Number three, gallstone can always be dissolved with natural remedies. People believe that it's falsely, it's not a true, that natural remedies are enough. No, no, no. Compulsory you have to attend, you have to monitor it and take a doctor's advice because they don't come down. You can only little prevent the growth, but once it comes, it keeps on growing. You can only stop at best growing. But once it comes, you have to remove. Otherwise, it will not go. Just like that. Natural remedies will not be helpful. So you have to compulsory take the help of a doctor. Usually they go for surgical treatment. It is laparoscopic and it's not a complicated surgery. It's very safe and simple procedure. So skipping number four, myth or false belief is skipping meals helps reduce gallstones. Some people they try to skip the food. They do fasting. They do intermittent fasting. Sometimes they do a lot of times they don't eat food or reduce the food. That will not solve the problem. It's a myth. So to overcome this, you need to eat balanced diet only. Okay. Particularly, you shouldn't eat too much of high fatty food, too much of high sugary food. You should not eat high processed food. You should take a lot of high fiber food, good in proteins and vitamins and minerals and so on. Okay. So you should not skip the meals. Actually, by skipping meals, actually problem may become more tougher because it will may increase the concentration of the bile formation or gallstone formation by crystallizing, increasing the risk of the crystallization of the this cholesterol. Number five, gallstones are harmless if they don't cause symptoms, which is also not true. Even sometimes you don't have any symptom, but still it may be size may be bigger. So they doctors that's why they take the final call. So they look at the size of the stone and whether you get pain or don't pain, symptom or asymptomatic. Usually doctors let them take the chance, let them take a call, and they decide. Okay. So even if they don't cause any symptoms also, but it's always good idea to get monitor. So these are the five myths and facts you need to know about the gallbladder stones. So let me come out of diet and obesity and the lifestyle habits corrections. So how diet influences gallstone formation so that you'll be aware of what's happening. Number one, excess refined carbs and sugars like roti, maida roti, refined roti, those are very dangerous. Okay, like refined flour. Okay, you should not eat refined flour. You should not eat white rice. Because refined carbohydrates, white rice, sometimes rice based, dosa, idli, and roti based, carbohydrate based. If you eat excess, then it will be problem. I'm not telling don't eat. I'm telling excess. But most of the time, our culture is eating a lot of high sugar food. We eat a lot of high carbohydrate, high starchy food. So that causes insulin resistance and elevated triglycerides. So that end up in gallstone. So sugar, high sugar, okay, it leads to high triglycerides, high fat, high insulin resistance that eventually causes gallstones. So remember the link. Okay, so it's not just only fat, high fat diet, but also eating lot of sugary diet or starchy diet, carbohydrate. Number two, eating low dietary fiber is very, very helpful. That means you have to eat a lot of fruits and vegetables, which are God given, naturally given. So, of course, there are a lot of pesticides and other things, but you have to be prepared how to clean them and how to use them. But you have to eat a lot of fruits and vegetables. It's not the fruit juices, but eating fruits because that give you a lot of fiber. So, and also some lentils and whole grains. They're also very helpful. Number three, so excessive saturated fat. So you should not eat saturated fat in excess. You require 10% of your diet should supposed to be saturated fat. 90% of the fats should not come from the saturated fat. It should come from the unsaturated fats. So actually in a meal, average scientists say the calories should not come more than 30% of the calories should not come from the fat. Out of 30% also, mostly the calories should come from the omega-3 fats or unsaturated fats or good fats, not from the saturated fats. Saturated fats are called as bad fats. So for example, dalda, butter, vanaspati, creams, mayonnaise, those kind of things. The food which is the fats which are in room temperature, they're in solid form. They're called saturated fats. We should not take it. Okay, we should not take in excess. We may take it little, but not in excess. So that's why don't take excess of carbohydrates, excess of saturated fats, and we always go for a high fiber food and don't go for rapid weight loss. Some people go for crash dieting. They don't mind losing weight no matter what, which is not correct. So go for a healthy weight loss. Half kg to 1 kg per week is okay. When you are supported by nutritionists. And when you don't have any such kind of advice from nutritionist or no nutrition intervention, then you have to go even slow. 1 month of half kilo, 1 kilo to 2 kilo. That is when you don't have Herbalife or any that kind of intervention. But when you have nutrition intervention, when you have coach, you should be still going half kilo to 1 kilo per week. So monthly 4 to 5 kilos, 6 kilos, that's okay. Not suddenly 15 kilos, 20 kilos in a month. That's a rapid weight loss, which is not good. So that actually is one of the triggering factor for gallbladder stones. So obesity is also risk factor for cholelithiasis, or in other words, is called cholelithiasis. In other words, is called gallbladder stone. So you should not be, if you are overweight or obese, come down. Bring it to a normal BMI levels. But don't see only obesity as a main factor. That what you have to see is the fat inside the body. Sometimes people will be lean. They call it tofi or sofi, slim outside but fat inside. They look wise thin, but fat is there inside. So that is the reason why obesity in the sense, sarcopenic obesity also. What is sarcopenic obesity? Many people are slim inside, but they are fat, slim outside but fat inside. So if there is excess fat inside, it causes risk factor for cholelithiasis. There is gallbladder stones. So weight loss definitely will be helpful. And Gall's lifestyle, what are the other risk factors? This is what, according to hepatology, one a study published in 2008 is saying high glycemic index diets, means high sugary diets, high carbohydrate diet, high starchy diets have been associated with gallstone development. So a study in hepatology in 2008 reported a 20% increased risk in individuals with consistent high carbohydrate, low fiber diets. Unfortunately, many Indian diets are like this. We eat puri, pani puri, most of the foods, samosas. They don't have good fiber. They're mostly sugar, roti, chapati, not whole grain, but refined flour. Rotis, chapatis, not good. And particularly, we are eating high when you are supposed to in limits. But in olden days, they used to eat a lot, but they can able to digest. Now we are not doing so much of manual work. So that is the reason why the burden of high glycemic index is becoming more nowadays. So also end up in diabetes and triglycerides, that way indirectly causing gallbladder stones also. So beware of high glycemic diets So beware of low fiber food. You have to take more of fiber, less of sugary diet, starchy foods. In lifestyle habits, exercise will be having a lot of good benefits. So always prefer exercise, not only exercise but also lifestyle, healthy active lifestyle. Some people do half an hour exercise but they are not active, whole day they are sitting. That's not correct. Modern day research is saying active lifestyle, not just only exercise, will be helpful. Mean throughout the day be active, don't be sitting all the time. Sitting is like smoking. Okay, movement is like medicine. Okay, motion is the new lotion. Eat a healthy diet, balanced diet with 6 to 7 colorful meals, very important. So maintain a healthy weights also very important. Weight means body fat and muscle mass, visceral fat, all that should be as per levels. That's what we monitor. We keep on asking customer. We check inside body composition, not just only BMI or weight. Number four is losing weight gradually and not rapidly. Very helpful. So systematic, and some people don't lose weight. That is also not correct. Some people too fast also do want to lose weight. Not correct. Gradually, slow and steadily, but over a period of time, taking help of a coach and taking help of nutrition and lifestyle habits correction, so that you don't bounce back also, you don't come back also. Number five, do not skip meals. Try to have a meals at a fixed time, so that the disciplined diet is always will be helpful. Eating in time, chewing properly, having good eating habits, sleeping habits, drinking water habits, and overcoming the addictions always will be great help, definitely. So to know more details, you can always be in touch with us. Instagram, Facebook, website, YouTube, email, phone numbers are given. But when the crisis come, you have to approach doctor only. Medical, when you have problem, treatment is from the doctor. But for us, you just have to meet us in case you require lifestyle habits correction or help on the nutrition or on the exercise or those kind of lifestyle corrections or education. So we are into this field for last 22 years. I personally myself do a lot of exercise. I do marathon running and also do Ironman. And along with my children, I encourage my children, my wife, and everyone. So I also did full marathon and exercise, gymming, lot of things we do, and also teach a lot of people how to live healthy life, balanced life. This is very, very important. Not only you doing, but also teaching people on how to improve their lifestyle. Uh, that goes a long way. So this is what I do. I coach, I mentor. In case you wanted to, you are interested, please let me also know. If you like this video, please like this video and share these videos to your friends and family members. Subscribe to my channel for further updates. And if someone referred to this video, please talk to that person, not me. Okay, talk to that person whoever referred this video, so that they will be in touch with you, they'll be guiding you. But thank you so much for your time, valuable time, for attending this video, for having me, understanding you the content. So wish you all the best. God bless you. Thank you so much for viewing. Tata, see you. Bye bye.